Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. In today's home exercise tutorial, we are going to go over a comment slash question that has come up a couple times in the last couple of weeks, so I thought it would be a great topic for a next video. And the first issue or problem that this exercise progression will address is any of you who feel like when you stand up, your leg actually flexes up or draws up off the ground. Some of you have mentioned maybe not when you're standing, but at night when you sleep, your leg draws up on you. And that is what we would call a flexor spasm or a flexor synergy pattern. So you guys have heard me talk about synergy patterns in a lot of other videos, but they're basically just involuntary movement patterns that can happen after any type of damage to your brain or your spinal cord. And then while I was putting this together, I realized that this is really going to help another huge problem that's been coming up or that people have been asking about, and that is, what do you do during the flaccid stage, or what exercises are best? So basically what we're going to be working on is extending that leg or preventing that involuntary flexion in this video. But before I get into that, if you haven't yet subscribed, go ahead and hit that subscribe button, click that notification bell so that you can be notified whenever I post new videos. And one other thing I just want to touch on real quick before we get into the video is I am so grateful for all of the comments. Ever since I started this channel and you guys have been engaging in the comments, I've really started to appreciate how aware a lot of you are about your problems, and that is great because you're very specific with your questions and pretty detailed in telling me what your exact problem is. So I think that's awesome. That's not something that everyone can do, is have that awareness to know exactly what's going on in your body, but it definitely helps you. The more aware you are of what's going on in your body and the more knowledgeable you are about some of the terminology, the easier it's going to be for you to help yourself, either by going through the playlists on my channel or just by doing your own research. So I just really wanted to give a shout out to all of you that are taking the time to learn about the movement problems that you have and learning how to help yourself. And then also you're engaging in the comments. A lot of you are answering each other's comments, which I love. So thank you all for leaving your comments, and keep them coming because they definitely help me to know what topics to create videos around. So now, enough about that. So let's go ahead and get into the problem that I mentioned earlier and then the solution and how you fix it. For those of you who are noticing that your leg is drawing up involuntarily, either at night or worse off when you go to stand up and the leg actually needs to straighten out and it's drawing up off the floor, that is, as I had mentioned earlier, what we call a flexor synergy pattern. It's one of two patterns that can happen after a stroke. The extensor pattern, where the knee locks out, the foot plantar flexes, and a lot of time the leg draws in towards the other leg. Flexor pattern, synergy pattern is just the opposite. The knee will draw up and out to the side, and the ankle usually flexes up. That can be extremely debilitating, especially when you go to step your other leg forward and you actually need that leg to stay straight. So if you are dealing with that, as you know, that can be extremely debilitating because every time you want to advance the other leg or step the other leg forward, if that leg is drawing up on you or flexing up on you, that's a problem. So before I get into some exercises that have worked for me in working with some of my patients, I wanted to talk a little bit about what can make a spasm occur or what can make spasticity worse. That's something really important to know and eliminate as many of those things as possible, especially when you're walking. I've talked about this in other videos. One of the things that can make spasticity worse is pain. So I actually have a patient right now, and when the top of her shoe is laced a certain way and the laces or that part of her shoe presses into the top of her foot, she goes into that flexor spasm or flexor withdrawal, and that leg actually flexes up on her. So first and foremost, if that's happening to you when you're standing, look at your footwear, try a different pair of shoes on and see if that doesn't help a little bit. Along those same lines, Whatever is touching the bottom of your foot can also cause that to happen. So if you walk around your house barefoot or without footwear on, any change in the surface might be a little bit shocking to the bottom of your foot, and that's another time or opportunity where that leg might draw up. So you might actually elicit a little bit of a spasm with that. So if you fall into that category, definitely have indoor shoes that you wear that do have a pretty solid sole on them, so your foot is getting nice even pressure along the entire bottom of your foot. And then pay attention to things like what kind of clothing do you have on that might be rubbing against your skin, temperature of the room, are there certain temperatures that make it worse, and try and modify some of those things that you can control in your environment to decrease the chances of that happening. So that's one really big thing that you could do right off the bat to maybe not make it draw up as much. And then of course, as I've talked about in my whole series on spasticity, one of the best ways to decrease spasticity is voluntary movement, specifically in the muscles that make the leg move or the arm move opposite to that pattern. So those are the exercises we're going to go over today. Again, a lot of times the leg will flop out to the side. So we're going to work on internally rotating the leg, which I've done whole videos on this, but I'll briefly just go over a couple of the exercises that I've shown in other videos as to how to work on internally rotating the leg. A lot of times, because that leg is always flopping out and is probably doing that at night, they're also very tight, so you also want to make sure that you're really stretching that leg internally. Remember, the longer those muscles are, the less likely you are to elicit what I call that stretch reflex. So if the muscle is lengthened too quickly, then that can make that muscle kind of recoil. So you really want to make sure that you're doing a good job stretching those muscles out to make sure that muscle is nice and long as well. And the key muscles for that, or the culprits, would be all the muscles that pull the leg out to the side and externally rotate the leg. And then once you get them all stretched out and they're nice and long, then you will work to activate the muscles that internally rotate the leg. I would start with the leg flex because that's going to be an easier position to internally rotate the leg. But then definitely you want to learn how to internally rotate your leg with the knee straight. And really the only way I've found to work on that internal rotation while keeping the knee straight is to put a knee immobilizer on it. So that is going to be a key tool that we use for several of the exercises in this video series. I'll put a link for the knee immobilizer that I like, that is the most durable, down below. I've ordered several different ones on Amazon just to kind of compare and contrast, and this is the one that I've found is the most durable. So after you do that with the leg bent, you put the knee immobilizer on and you work on internally rotating that hip without bending the knee. That is critical. So why do we do this? The reason we do this is that those synergy patterns are where multiple joints move together. If the hip moves, the knee is going to move in coordination with that. And what we're trying to do is we're trying to isolate each joint and break up those patterns. So isolating hip internal rotation is the goal of this exercise. Now, again, this is only for those of you where your leg draws up. This would not be the same progression I would recommend if you are someone where your knee locks out when you walk. Obviously, then you're trying to keep the knee unlocked, and you definitely would not want to put a knee immobilizer on it because that is just going to facilitate that knee to lock out. And then the next exercise I really like, I've shown this one in a few other videos, it'd be the Jane Fonda exercise. So that would just be laying on your side and lifting that leg up out to the side. Now, the key to this one is not to let that leg externally rotate. So you want the knee to either stay pointing straight ahead or even slightly down. The other thing you could think about is you want to lead with your heel. So that will ensure that you're not externally rotating, because that leg, if you have that flexor synergy pattern, it's going to want to externally rotate whenever you move it. So we're trying to internally rotate it while you lift that leg up out to the side. So that would be the other one that I would do laying down. So another great mat exercise that I love that is critical for relearning how to extend that knee, whether you are in the flaccid phase and you're just trying to activate those muscles, or whether you are someone who has that flexor synergy, is laying on your stomach. And here you can either use the Core Max. I love this Core Max. These little bars on here are kind of springy. And so you would just put your ankle or put your leg so that the ankle is right underneath one of those bars so that the bar is right underneath the involved ankle. You can actually put both legs up on here and you're basically going to extend the knee. Now, the reason I like this is you really do learn how to extend the hip as well. So you're learning how to extend the hip and the knee at the same time, which is really critical for walking. And I would spend a lot of time on these every single day. And then what I like to do, or what I like to encourage people to do, is follow up any type of mat work or movement retraining with some type of functional activity. And that will be the topic of next week's video. But for this week, that is it. So what to expect in next week's video? I am going to go over the functional component that will carry over the movement retraining that we did in this video. So again, if you are someone when your foot hits the ground, your leg draws up into that involuntary flexion, or you are someone who is in the flaccid phase and your leg is kind of floppy and you can't generate the strength or the power in the muscles to keep the knee and the hip extended when you stand on that leg or when you load your involved leg, then definitely next week's video is for you. So it'll be a standing progression working on relearning how to extend the knee and the hip to support your body weight when you're standing on that leg. So definitely look forward to that video. And that is it. I hope you all enjoyed this. I hope it was helpful. Again, keep the comments coming. They definitely are the inspiration for most of these videos, or they are where I get the majority of my video ideas. So comment below if you have any questions, concerns. Again, this is the best place to get an answer to your question. If you have a question about a video, this is the best place for you to get an answer to that question, and leaving it here, there is a chance of it turning into a video and potentially being able to help other people. So if you have a question, you have a comment, or you want to share your exact movement problem, leave it in the comments below. If you haven't subscribed, definitely before this video ends, go ahead and hit that subscribe button, turn on that notification bell. And that is it. I thank you all for watching. I appreciate every single one of you. Keep working hard, and I look forward to seeing you all in the next video.